President Obama has been insightful in realizing that one of the tenets to ensure a robust and lasting recovery is a strong healthcare reform bill to ensure no one needs to be bankrupted by medical costs and to ensure that companies who provide medical insurance to their employees can do so in a deterministic way, thus ensuring they can compete effectively with countries that do not place an inordinate burden of healthcare on private companies. Make no mistake, all positive social and humane changes in this country have been effected by progressive liberal Democrats and progressive liberal Republicans. It boggles the mind why the Obama administration is incapable of articulating effectively that there are two major components to healthcare. The first being paying for healthcare. It is simply a process tantamount to paying a bill that requires no innovation, that morally should not be for profit. The second being the delivery of health care, the process of treating, housing, and medicating a patient, in which innovation provides for better health care, justifying a profit motive in order to provide incentive. If that is understood, it is easy to dispel justifiable citizens' fears that the administration is trying to nationalize healthcare by illustrating that private insurance companies are currently skimming 30% of our premiums to pay overpaid executives, advertising, lobbying, and shareholder dividends, and is much more expensive than one entity collecting all premiums and paying all insured medical bills. Additional efficiencies garnered from doctors no longer having to spend time fighting private health insurance companies to provide requisite care to their patients will also increase the number of patients they can see, thus reducing costs per patient. This is not conjecture. This is fact. Medicare, with all its problems, including fraud, the inability to negotiate for drugs, and an older, sicker population, is much more efficient than private insurance. All of this information is readily available and verifiable. If a progressive liberal president and a progressive liberal Congress with large majorities are unable to pass an effective healthcare reform bill with a strong public option, an option over 72% of Americans still want, and an option that will force insurance companies to be more efficient, this means that in effect we are becoming an oligarchy in which powerful private corporations, with the assistance of small but very loud, vocal, and ill-informed group of citizens, will dictate a policy that continues a massive transfer of wealth using private insurance companies as the medium to do so. This will continue the process of the average American's loss of wealth. The question is whether we will come to the correct realization before the transfer is complete.